So from where I sit, I am comfortable that starting 1st of July, Kenyans now need to start registration into SHA, and besides registration, also pay for their medical insurance. It's important for people to register because, one, the primary health care fund is being paid for by government, but you will not be able to access services if you are not registered. So you must register for Social Health Authority. When you move to the second level of service, you need to be paid up. So first, register. We had a challenge with the supply chain. We owe the vendors, that is Gavi and UNICEF, we owed them some money. There was a delay in disbursement, but last week but one, the disbursement was made, and we did an accelerated procurement, so the vaccines were received, and now we are tracing the children who might have missed. And from the report I received last week is that we had about 300,000 children who missed vaccines. That is, if you compare to the total that we need to vaccinate of 1.6, that could be about 18% or so. The surest way to access healthcare is to have medical insurance. I get many requests of people who need assistance for healthcare. If you compare the costs of having to pay out of pocket and the cost of paying your insurance, you'd rather pay your insurance. So we are now transiting. We have been planning from last year, October. We had the laws that were assented to by His Excellency the President. In March, the ministry worked and the guidelines and regulations were gazetted.
The carrier of the President is a statement, and you'll respond to some of the issues that are going to be raised. Are we together? That is with the intelligence of the CA.
Road which has been captured in the MTP. And
that is the copy of the MTP for...
We modernize the Kenya Coast Guard and improve the welfare of security personnel. To diversify so...
Thank you. Shia, then you. Kina mama mkijitayarisha. So nimesema ni swali direct.
Your concern was it was not captured here. But as a government, I think the CS is going to confirm something is being done. Our chief guest, even the participants are going to ask. But as the chair of the County Implementation Commission, I want to confirm that the road from Tarbo to Enter
and adequate funding for county function. They need to strengthen effective and meaningful public participation and citizen engagement through dialogue focused on the MTP so that we make sure that everything is fully aligned, as you can see from the presentation which are listening. In a nutshell, that is our highlights of our county integrated development plan covering the financial year 20 program to provide employment to youth and mentorship in life skills. This is very key, particularly with the unemployment program. Confirmation, absorption of ECT, expansion and upgrading of ETC, model VTC, and in collaboration with the national government and stakeholders to promote establishment to support joint ventures, public-private partnership and linkages among others. Then on general advanced stage, some water for market. We have market in the other side of Uganda, but in Kenya side.
I request you to, and before we go to the government officers, I request that we ask the so-called Mama Bogas. Do you get it? Because as we participate in the free, we are going to contribute, but I request that we allow